Welcome back to the Mountain Morning Show. A very interesting interview coming up with OBGYN Tanya Bodner. How are you this morning?
Good morning. Thank you so much for having me again. It's always such a pleasure.
We have loved having you on, especially because you are just so knowledgeable. You provide a whole page of talking points, which I love. Today we're talking about HPV vaccine. You know what HPV is, what it causes, and why you might want to get the vaccine.
Right. So HPV, also known as the human papillomavirus, is an infection. It is a viral infection, and what makes it a little bit controversial, uncomfortable, causing some conversations is that it is a sexually transmitted infection. So, and it's the persistence of this infection that then can cause lesions that can then lead to cervical cancer lesions, and then also a large percentage of the oropharyngeal, so problems in the mouth and in the throat, and the rest of sort of the genital lesions and genital cancer lesions. Mm-hmm. So that's what makes it sort of a bigger hot topic and a big deal.
Well, besides it causing cancer, which is obviously like red flags, a ton of teenagers have it. Like, do you know stats on how many?
So it is very common virus, and really we can say sort of 80 to 90% of our sexually active teenagers have had an exposure to it and can test positive for HPV.
Can test, explain that.
So we don't test HPV routinely in this age group because we also know that such a majority of them will test or can test positive. So we also know that our teenagers and our young adolescents have a really amazing immune system, and they can fight off infection, they can fight off viruses. So our testing and our screening protocols for doing Pap smears, which is really where we find the positive results, start once they're at age 21.
Which a lot of these vaccines, which we're going to get to, are, I mean, they can start as early as 9 years old. You're not doing a Pap smear on a 9-year-old.
Exactly. So
how, I mean, there's kind of like a confusion there.
There is a confusion, and I think it's important to realize this HPV vaccine is preventative care. This is, just like all the other vaccines that were given early on, because our youngsters have great immune systems that can take on these antibodies to be able to fight infection later on. We give it to them at that time, prior to having exposure to the HPV vaccine, prior to having lesions. It's not a treatment. This is giving them sort of the fighting antibodies so that they can fight off the infection when and if they become exposed to it later on in life.
Most likely when, rather than if, unfortunately.
So unfortunate, right. But that's what leads a little bit to this controversy, right? And some of the young women that I talk to, and it's part of their intake, part of their history that we take, did you already get this vaccine earlier? And we'll talk about sort of the age ranges of when it's recommended. Has it already been given to you by your pediatrician, by your family practitioner? And you would think that everyone says yes, and it's sort of amazing at the percentage of youngsters who have not received immunization, and I think from their own fear, their own concerns, and sometimes also from parental concerns, just because they're not fully understanding why we're giving it to them.
Well, there might be some hesitancy because, well, first of all, they're young. Second of all, I mean, I've heard from my OB that a lot of strands resolve on their own. So I know I'm thinking, well, is it even necessary to, give this series of shots if it's just going to go away by itself?
Sure. So, what's so exciting about medicine and the technology of medicine is that everything advances. And we've already gone through a couple of different types of vaccines that have been available, and now we're on sort of this third generation of vaccine. And it's because there are hundreds, there are thousands of different strands that we don't fully know all about, right? And as the years go by, we started with a vaccine that only affected 2 types or protected against 2 types. Then it went to the 4-valent one, and now we're at the nanovalent, which means that 9 different types, the most common and the most carcinogenic, meaning the most common cancer-causing types, are included in this vaccine. And that's over a short window of time. So, vaccinating now gives us great immunity, and we will continue to see greater immunity response, further along, and possibly for more vaccine virus types and strands in the future.
So you would say right now it's the best inoculation we can get?
I think it's super exciting. It's really amazing that we have a potential way to prevent cancer. How can we say that? You know, aside from living well and not smoking and, you know,
drinking your water and exercising.
Drinking your water and doing all those things, like we have something to prevent against cancer. And I think the reason why it's so exciting to me as a gynecologist and to other providers that are seeing it maybe on the other side is that, you know, we're doing the screening, but then we're also left with the burden and the responsibility of what to do with these results, right? You're positive for HPV, or you have some lesions, you have some abnormal cells that are starting to turn, and now we need to sort of step in and do something about that. And the fact that we could potentially prevent it and stop it from even occurring is really what's so exciting to me.
Right. Okay, so let's talk about the age groups that you should be considering to get your child in to get an HPV vaccine.
Right. So we focus a lot on cervical cancer, though it's important to know that it can affect both men and women. So the recommendations are to vaccinate both our youngsters, our young women, and our young males. And the recommended age time is around age 11 or 12. It is safe and known to be effective even as early as age 9. And if for whatever reason there was an interruption in receiving the series or something happened and you didn't get it at all, you can still play catch up, we call, between the ages of 13 through 26. So there's a large range. So really the majority of this is occurring through your pediatrician's office, through your family practitioner. And then once you come over to see the gynecologists on our side.
Once you grow up.
Once you come to this side, you know, we always ask and make sure that it's something that we can still get everybody up to date sort of speed if they wish. And that's where education and talking and giving out pamphlets and literature, and that's where that all comes into play.
All right, let's say you think you might have HPV. Are there symptoms? I mean, is there anything to make you think that you might have it, or you just think, well, I should probably just go get tested because?
Sure. So obviously if you are in a situation or you're in a high-risk sort of behavior population, you know, and talking about safe sex and how to prevent and how to take care of yourself is always important. But if you are in a situation where something may have occurred, it may not turn up positive immediately, but that's where seeing your provider and seeing your gynecologist frequently and regularly is really important. Typically, HPV is tested on a Pap smear, and those are for the high-risk strands that we know can cause cervical lesions, precancerous lesions, or cancer. And you don't just go from never having HPV to having cancer the next day. And that's why it's so important to have these routine interval exams. But there are high-risk strands and low-risk strands. And it's the high-risk strands that can cause cervical abnormalities and the low-risk strands that can cause other things like genital warts, things that are uncomfortable, painful, or that you just know are present, and there are treatment options for that.
Man, it's really, really unfortunate, like you said, 80 to 90% of sexually active teenagers, which is probably a lot, have HPV or are exposed to it at some point. The good news is you have this vaccine that will really, like you said, directly prevent cancer, so why not?
Right.
There was one other talking point I wanted to bring up. It was really interesting. The FDA just approved a new vaccine for older age groups.
So it is the same vaccine, but what the FDA did, which was sort of really exciting for the gynecology community, in early October they announced that now the age 26 or through 26 is no longer the limit, and women 27 through 45 can also be getting the vaccine, which raised a lot of excitement, and there were a lot of patients that would say, shoot, I'm 29.
Yeah, what do I do now?
Am I out of the range? You know, and in theory, yes, when these studies go out and the recommendations come out, sometimes insurances don't pay if you're out of the range of the recommendations. So now with the FDA coming out, the CDC is backing it up, the American College of Obstetrics and Gynecology is also really on board with it. You know, hopefully we will get payers and insurance companies to be on board as well, and we can start vaccinating this other age group, which is really exciting. It really provides more prevention.
Right.
Which brings up a topic. Even, you know, we like to target women prior to being affected by the vaccine.
Yeah, what if you have it?
But what if you have it?
And you're 29.
You can still be vaccinated because there are other strands, right? There are other strands that we're trying to protect against. And that should not be a reason to stop you from getting it. Or not only that, but if you're already just sexually active, go ahead and get it. If you're in this age range, please do. It's such a great way to protect yourself.
So interesting. I'm glad we've talked about this because I've totally had the mindset, well, it just resolves itself by the time you're 30. You could get it, you could not get it. But the fact that, like you said, the ultimate goal is to prevent cancer.
Right.
We know that HPV causes cancer, so why not?
Right, right. So exciting. And you're right, it can clear on its own, and many times we see that it does, but it's those cases when it didn't, when you're sort of going, oh, and if we had just had that prevention, if we had just had that immunization, what could have happened, or where could we be? So,
can I ask a couple devil's advocate questions?
Of course.
What are some risks for getting these vaccines?
So really, it has a really good safety profile. The vaccines have been shown to be safe. There are always adverse side effects that have been reported, and really the most common of which are local site injection, soreness, redness, swelling, just discomfort just from any kind of injection. Also headaches have been reported, but overall the FDA has shown and proven safety, which is why it can be given so young and why the age group now has been extended up through the age of 45, because we've seen through the studies and through long-term safety models that it is a safe vaccine.
And the reactions that are reported are mild. I mean, we're not having seizures from the HPV vaccine.
Right, the most common are mild.
And okay, and the other question I had was, just how effective is the vaccine?
It is very effective, and the models and these long-term study models show that hundreds of thousands of infections can be prevented, and therefore, if the infection's prevented, then the subsequent lesions, abnormal cells, and possibly cancers can be affected. So, we look at it very much sort of in our community in the United States, just locally. Globally, it's a huge problem, right? There's 500,000 cervical cancer diagnoses a year and 250,000 deaths. So it spans worldwide.
Absolutely.
And it really can be a great tool for us as preventative care.
Dr. Barner, I am so grateful you're here. I'm grateful that you dealt with all my questions. Sorry, this has kind of been a long interview, but I find this stuff so interesting because science is completely changing, and there's ways that we can prevent cancer, which we've not been able to say that before.
Absolutely. Thank you for having me. This is always so exciting to have the opportunity to speak broadly and to try to capture an audience that I think is receptive to getting some information.
Absolutely. All right, guys, stay tuned. We have a lot more coming on the Mountain Morning Show. Thank you again. We'll be back right after this.